announcements today. But before we kick off, I want to kick it over to my colleague, Kate Barut, about our member meeting coming up next week, or this week, in 2 days.
Hi, everybody. It's so good to, I guess I'm not seeing everybody, but so good to be with some of the members here on the line and some of the folks who are considering membership. I'm the membership coordinator here at the Federation. Make sure, if you haven't already, to check in with your co-op or with your organization to see if you all have availability to send a representative this Thursday to the virtual member meeting. So I know there's some newer members on this call, and so I just want to stress that this is one of our spaces that is organized and used every year to ensure, we comply with our governance and to make sure that the membership can participate in the decision-making of the organization and also engage around the board elections and hear about and ask questions about what the Federation is up to. So it's a really awesome space for the members to give input in some of the programming coming up and planning coming up with the Federation. It's an opportunity for you all to get to know who's running for our board this season, which is very exciting. We have a really amazing set of nominees this year. And it's an opportunity to ask any questions and see some of the behind the scenes reports on what we've been up to. So that's going to be this Thursday, September 23rd at 6:30 Eastern Time, 5:30 Central, and 3:30 Pacific time. And I'm going to send the link for you all to register via the chat. And what I would say is, since you all are here, go ahead and register. And then if you end up sending somebody else from the co-op because you personally can't make it, you'll have the link to the meeting in your email to forward to the rest of your team. And you'll also get a recording of the meeting after the fact. So I'm going to send that email to make sure you all register for the member meeting. And if you have any questions about that, you can also ask them over the chat. Thanks, and really excited to be with you all on the call.
Thanks, Kate. So today, like I said, we're going to be looking at dental and vision insurance, sort of more in depth, disability and accident insurance, more in depth, and sort of what the process is for open enrollment and getting ready for having those benefits in 2022. The most important dates to note right now are that the open enrollment period runs from October 1st to December 8th of 2021. So starting October 1st, if your organization is ready to go, you can just get the registration and enrollment done then. And if you're not quite ready to make that move, you have until early December to get those ducks in a row and answer any questions and read up on what we're offering. Our worker benefits program has been around, this is our 5th year of the worker benefits program, which is really exciting. We created the worker benefits program because we recognized a pretty big need across our members to have a way to access some sort of health benefit for the workers that are in our ecosystem, because in this country, health benefits are most typically tied to employment. If people are not able to get any sort of federal or state benefit, employment is the way that is sort of the standard way. We at the USFWC and me personally feel very passionately that healthcare is a human right. We should have universal healthcare that is free and accessible to everybody, no matter who they are. But until we get that on a policy level, on a national level, the worker benefits program sort of exists to help our members navigate the system and just to create options in the system that we have. So that's my job. I'm really privileged to work with you all and to be able to do this work in the space where we can also acknowledge that this is not an ideal. The worker benefits program is open to all of our members across all our different membership levels. who meet the qualifications of the plans as set by the insurance companies or by federal and state regulations. The benefits are available to people with social security numbers or individual tax identification numbers. Citizenship is not something we are ever asking about or considering in the worker benefits program, and we don't store this personal information in our databases. That goes straight to our broker and the insurance company. We do strive to do whatever we can to make these plans as inclusive as possible for LGBTQIA folks. Our plans that are open to partners don't discriminate based on anybody's gender of the partner. With the exception of tax advantaged arrangements, couples are not required to be legally married. The only thing that we say is that the insurance companies are within their rights to ask for some sort of documentation of cohabitation or shared finances. So we recommend that you be able to provide that if you sign up as a partner. We also have implemented a system on our end of things that helps or is designed to help minimize contact that people have with dead names or old names if they are using a different name than they have on their legal paperwork or a different gender marker than they have on their legal paperwork. The insurance companies require that information for their systems and for how it all integrates with Social Security and the federal government and taxes. But it's really important to me to help sort of navigate and mitigate any of the harm that comes with that within my ability. To that end, I'm always interested in feedback and suggestions for how to do that better, or if there's other things that I'm overlooking that we could design around. I'm really interested in that to make this as inclusive and useful as possible. Finally, really important, I am not an insurance broker. We do not have an insurance broker on the staff at the USFWC. We contract with an insurance broker that helps us, that sets up these plans, helps us administer them. And when there are questions that sort of get to that level, I pass them to him and either relay them back or put folks in touch directly with him. Diversified Human Solutions is the company. The broker's name is Matthew Tay, who some of you might have met before or encountered on a webinar before. His company is part of our membership, and he is really committed to helping our members navigate these systems. So these are the programs that we are working on, that we have available. Our dental and vision insurance are our oldest and most widely used programs. I'll get into a lot more detail about them in a little bit. We've also recently introduced accident and disability insurance, which are voluntary programs that individuals can opt into if the workplace decides to offer that as a benefit. We have some options for health insurance and tax advantage reimbursement plan, methods of paying for healthcare costs. And then another big part of our program is doing research on additional benefits that we could offer in the future as the program grows. So retirement benefits are one of our biggest areas of research. And if you're registered or coming to our member meeting on Thursday, you'll see in the member packet for that meeting that there's actually a new brief about the research we've been doing there. We don't have any programs ready to implement yet, but it is something that's very much still in the background, something that we're working on. Our program is very much a power in numbers sort of situation. We have about 500 people enrolled in the plans, which helps us both negotiate the rates that we have and, most importantly, the strength of the benefits that we offer. It also helps centralize the administration. It's a lot easier if you can just come to me and enroll a workplace rather than having to go and shop around, especially with smaller groups. And by having the centralized role of the worker benefits program manager, you can get pretty easy access to support with troubleshooting and administration, as well as access to our broker who supports us with issues that come up, particularly with using the plans. If there's ever like a claim issue or something like that, our broker has been a really great advocate for getting the insurance company to move on those kinds of things, or to help a dental provider figure out that they need to submit something with a different code, things like that. So we're gonna kick off with dental and vision insurance. And like I said before, this is our largest program. We have about 50 organizations enrolled across the United States with about 500 individuals enrolled. This is because dental and vision insurance are completely separate from medical insurance on a administration and coverage level. The programs are able to be national in a way that health insurance really can't be. So we have one plan across the country available in every state with a set rate across the whole organization. Because it's one plan, that plan gets billed to the USFWC, and then we essentially break up the bill and distribute it across each organization each month. This has also allowed us to be really flexible as like financial struggles have come up on the rare occasion that they do for our members enrolled in the program. We were able to be really, really flexible around the sort of initial financial shock of the COVID-19 crisis. And we're able to accommodate some people leaving the plan temporarily and then coming back. Though it was really amazing to see how people really prioritized keeping these benefits active for their organizations through that time. As I was saying earlier, the perks of joining our dental and vision plans is that by going in as a large group, we're able to leverage both the prices to be lower and the strength of the benefits to be higher, while also allowing coverage to start pretty much immediately without any sort of waiting period for those who are enrolling during an open enrollment period or a special enrollment period. Organizations all across our membership, all of our members are eligible to join. The only sort of additional threshold is being for our associate member class, where the minimum dues are $500. We require that workplaces pay 50% of the monthly premium for workers in order to sort of stabilize the plan for workers and help it just sort of spread that financial assistance on both to the workplace and to the workers. Workplaces are not required to contribute to dependents of workers, though we do encourage workplaces to contribute as much as they can. The only minimum enrollment threshold that we have is for the dental insurance plan, which requires a minimum of 70% of the eligible workers to enroll that don't have dental insurance through another means, whether it's through their partner or a parent or a different configuration. Vision is completely, there's no minimum for vision. Excuse me. Individuals who want to enroll in the plan, workers either must be on payroll or must be paid as owners of the company. They must work 20 or more hours a week on average and have either an ITIN or a social security number. Folks can enroll dependents until the age of 26, like with general health insurance. And partners and children are eligible for coverage. Like I said, legal marriage is not required and are open to people of all genders. And yeah, like I said before, disclosure of legal name and sex are required, but if folks use a different name or a different gender marker, we're happy to accommodate and try and minimize contact with a dead name or old name or an incorrect gender marker. Some highlights of the plans that we have. The dental plan is available through Emeritus, which the plan offers 100% coverage of 2 routine exams a year, 2 routine cleanings, annual x-rays, and for children, it offers fluoride application each year. And then for procedures that are more complicated than that, they're covered at 80 or 50%, depending on what the procedure is. And we have that breakdown available. The plan covers up to $1,500 per year per person. And the really great thing about the Emeritus plan is that it's a PPO that offers the same coverage for out-of-network providers as it does for in-network providers. The only difference being that for out-of-network services, you have to submit that reimbursement yourself. IMED also has a small copay for an annual eye exam. IMED is our vision insurer. It's a $10 copay for an exam that includes dilation if that's a necessary part of the exam. When they put the drops in your eyes and then everything's very bright for a long time. For standard lenses that are from an in-network provider, the copay for lenses is $20, and then each person has access to a $130 allowance per year to be spent on either frames or contact lenses, with some additional coverage if the expense is more than that. So that's sort of a bird's eye view of the plan benefits. And then if you want to see more in depth, those documents are available on our website, and yeah, easily accessible. These are the 2022 rates for dental and vision insurance. On top, you'll see the monthly premium rates per person per month. So for dental insurance for one worker, the premium is $36 per person per month. And for vision insurance, it's $7.80 per person per month. Then going up to cover worker plus partner, worker plus any number of children. Could be 1 child, could be 10 children, could be however many children you're the legal guardian of. And then family plan, which is partner plus however many children. On the bottom, we then have our monthly administrative fee, which is paid per organization on a monthly basis to the USFWC for the sort of ongoing maintenance of the worker benefits program and the troubleshooting and support access you get by participating in the program. To be clear, the numbers on the bottom are per organization per month. So this is not another per person fee. This is simply per organization. So for the organization, I'm seeing a question. For rates, the co-op has to pay the administrative fee and each member pays individually. So thanks for that question, Raylan. So for rates, basically each month, the worker co-op or the organization will get an invoice with the premiums for all the workers in that organization itemized, plus the administrative fee. So the workplace is responsible for paying that full fee, and then how you break down the individual premiums is sort of on an organization basis. Though, as I said before, 50% of the worker premium does have to be paid by the organization. And the worker premiums can be deducted as a pre-tax deduction for folks who are on payroll. I'm seeing a follow-up question. Are there bundles that, like a fee that covers each premium and the members have an administrative fee? I'm not totally sure I understand the question. Raylan, if you wanted to ask it aloud, you're welcome to, or clarify.
Yeah, hi. So my question is then, like, in regards to how it's laid out right now, is that each member owner would then have to pay like each premium that they choose, right? Plus the added, and then the co-op would then pay the administrative fee. What I meant about the bundle is, I guess, like, is there because I don't know, I forgot if I saw it on a slide or something, but if there's like 8 members for the cooperative, then it would then, oh, I guess that's administrative fee, but I was like wondering if there's like a bundle in regards to, like, you pay, let's say, like, this is a made up number, like $300 per month, and that covers the administrative fee, and let's say like single workers for like the just like single workers, and like 8 members of that. I don't know if that exists, but I was just like wondering if there is like a bundle that exists like that, or is it more so than customizable in regards to the member owners can then pick which premium rates they would want, and then we just added on the co-op rates or the administrative fees, I mean.
Yeah, so the workers can opt in. Essentially, everybody gets a form that they fill out, which says where they make their election. So one worker can elect dental and vision, another worker can elect just dental, another worker could elect just vision. And then we would bill for just what people signed up for within the organization.
Oh, okay, that makes sense. That clarifies. I have another follow-up for tax deduction, because most co-ops are then filing as like they're all business owners, right? So for tax deductions, can they then, I guess, like if like one member owner picks a single worker one, both dental and vision benefits, as well as like pay into, or like we pay the monthly administrative fee, can they deduct that whole amount even if for when they file their taxes?
I don't want to answer a specific yes or no because I just am not positive. I think that it can be deducted the way that any health benefit can be deducted in like a tax deductible kind of way, but I would want to check with your accountant or whoever else is supporting with tax filing for that.
Okay, and then the inquiry would then be asking if the health coverage can be deducted in taxes, right?
Yeah.
Okay, thank you so much.
Yeah, you're welcome. Cliff, do you have a question?
Yes, you've kind of covered pieces of this in different parts, but I wanted to say before I forget, we pay ourselves in our co-op as independent contractors as opposed to being on payroll. Is there like kind of an overview of the impact of that in this scenario so far?
Yeah, so unfortunately, we can't provide coverage for independent contractors. It's just the way that the health insurance companies work. We're sort of looking into if we can set up a different situation for that, but it's not it might not be happening for this open enrollment period.
Totally. We're in the kind of works of getting onto payroll because we can. It's just work. So maybe sometime when we do a follow-up, we can ask other people on our network about just paying ourselves as owners, which is a frame I'm just not even familiar with because we've only ever done the independent contractor stuff. But it feels like there's an option there, but we can follow up that separately. Thanks.
Sounds good. Great. These are really important questions. Are there any other questions about how the billing works or how the premiums work at this point? All right, well, I'm going to move into sort of a little overview of how the plan works and how the sort of responsibility breakdown works. So open enrollment is coming up in October. And so open enrollment, particularly for vision and dental, is sort of a team effort between me and you and your organization. So during the open enrollment period, Typically, I'm interfacing with one or maybe two people at an organization that are sort of the messenger on to the other workers or employees at their workplace. So it's my job to sort of provide the information to whoever those point people are, and then those folks' roles to pass that information along, to inform workers of their eligibility, what the plans are, and to make sure that the folks who want to enroll are filling out the forms that need to be filled out for open enrollment. After open enrollment, that point person sort of continues to be the liaison between me and the rest of the workers at the co-op, or the organization. Though that person can change over time, that's not a problem. It's that person's job to coordinate with me if people are missing their insurance cards or have a question about how the coverage works, to inform new workers of their eligibility for the dental or vision insurance, support members with interfacing with me, and then inform departing workers of their eligibility for COBRA, which is the mechanism that allows people to continue their benefits at their own personal cost after they leave an organization. And I'll go more into that in a little bit. It's my job and the USFWC's job to make sure that you have that information available to distribute to the other workers in your workplace, to answer your questions or refer them to our broker in a timely manner, to distribute the forms, make sure everybody has the forms and information that they need, and to communicate about any missing information where possible. If I don't know that the information exists, I can't communicate about it. But if if I see someone on the roster, but the form isn't there, we sort of have to work together to make sure that that form comes to me. After open enrollment, I'm responsible for distributing the billing, monthly invoices, for processing the changes that come into your enrollment and making sure that those are corresponded to on the bills appropriately, supplying insurance cards and plan information, and answering questions and referring to the broker as needed. I'm seeing another question from Dele, who's saying, my accountant says that in New York, contract workers are considered employees on the payroll. How does this impact our ability to have the worker owners participate in these benefits? That's a great question. I think New York, often a lot of things are happening that aren't happening in other states. It might be a different story. I would want to sort of approach that on a case-by-case basis with you, Dele. And like I said before, we have COBRA, which doesn't actually have anything to do with the COBRA. I just thought this illustration was cute. It's the Consolidated Omnibus Budget Reconciliation Act, which essentially created an opportunity for people to continue to receive the benefits that they receive through their workplace at their own personal cost for typically up to 18 months. The health and the dental and vision benefits are part of the benefits that are eligible for in COBRA. The worker will automatically receive a notice of their eligibility for COBRA when they depart the organization and we learn that they are being terminated from the benefits on their workplace's roster. But sort of at that point, it's the worker's responsibility to decide if they want to enroll in COBRA and then to deal with the paperwork and the payments after that. So it's mostly just important that workers know that this is available, but once a worker and a workplace part ways, it's not on the workplace to continue that administration unless you want to and are set up to do that. So to get into the details of how the open enrollment process will go, it's really good to hold a meeting with the workers in your workplace to talk about the benefits, identify any questions that need to come to me or to our broker. Then after that, determine who wants to enroll, keeping in mind that 70% threshold of eligible workers for dental insurance. Vision insurance, there's no minimum. Then for new workplaces, a roster gets filled out. We also, this year, I'm asking for a roster for folks who are changing their enrollment. So if anybody new is enrolling, I send out this template, which I just put a little screenshot in here to give you a sense of what it looks like. Has people put in their personal information, not including their social security number or their ITINs. So what's really important is that I receive this roster, and then I use this roster to check against the forms that I receive. Each new enrollee has to fill out this form. Existing enrollees do not have to fill out this form. But yeah, each new enrollee must fill out this form to get enrolled in insurance. If I don't receive one of these forms, someone cannot be enrolled. This is how we have social security numbers and ITIN numbers transmitted to the broker and the insurance company securely, so that I'm not storing it on my work computer. I don't want to hold that information. And then, yeah, the rest of the form is pretty straightforward. When you check the boxes for dependents, that opens up a new set of boxes to fill in the information for those people. Eden, I'm seeing your question about if you should include everyone who is eligible on the roster. And my answer to that is no. The roster should just include people who want to enroll. So there should be like someone within the workplace who is determining who wants to enroll, and you all can determine sort of how private you want to keep that information. And then the roster is really for me to check who is enrolling through these forms against who says that they want to enroll. So if I receive a roster that has a bunch of people who aren't enrolling, it's going to sort of confuse the system, and I'll be expecting forms and bothering you for forms that aren't going to come in. Okay, so I feel like I missed a slide here, but anyway, that's sort of where the open enrollment process ends for dental and vision. Once I receive those forms, in the new year, you'll receive your first bill that has the full roster. And also in the beginning of the year, I do a full audit of the forms that I have and the forms that I expected, to make sure that everything is sort of adding up. Then also early in the year, anybody new to the plan will receive an insurance card. People who have already been enrolled will not receive new insurance cards. But I'm also always happy to send a new one to people if they've lost them. Yeah, so are there other questions about the process? I'm seeing a question if we'll have access to the slide deck, and yes, we'll be sending out this slide deck with the presentation. Yeah, great question, Raylan. After this slide, I'm going to dive a little bit into accident and disability insurance. So right now is a great time for questions about the dental and vision insurance. All right, well, I'm going to go into accident and disability, and if any questions come up, we'll have some time at the end as well. So accident and disability insurance, short-term disability insurance to be specific, These are programs that we introduced for the first time this year. We have a couple people enrolled, but are excited about getting more folks enrolled and aware of the program for 2022. Accident insurance is a pretty simple mode of insurance where you pay a premium, like a flat premium each month. And then if any sort of medical accident comes up, a bike accident, work-related injury, and you need medical treatment, the insurance company pays flat payments in correspondence to different incidents that you experienced during that time. Short-term disability insurance exists to insure your income in the event that you are rendered disabled from an accident or an illness and are unable to work for a period of time. It's also relevant in instances of pregnancy and childbirth, though not for non-gestational parents or adoptive parents. The real huge benefit you get through these offerings from the USFWC is that because our broker is based in Pennsylvania, the rates for accident and disability insurance are based in Pennsylvania. This is either equivalent or less than almost every other state where we have a high concentration of members, where we looked into the state specific rates, particularly for co-ops and organizations in California and New York. So if you're in California or New York, this is maybe some pretty significant savings from what you'd get from a more localized plan. These are voluntary benefits, which means that workers pay for the benefit directly to our broker. It's paid for with post-tax money, and specifically, it's set up to be paid for by the worker. There's an option for the workplace to pay if you want to set it up like that. Though in that situation, if a worker were to receive those benefits, the benefits would be subject to tax, which they wouldn't be if the worker were paying directly. The other important thing about these benefits is that they are portable, which means that if a worker moves to a different workplace or onto another job, they can keep the benefit. So it's like they're leaving their job, they're packing their little suitcase full of their disability benefits and carrying it off to wherever they're going next in their life. This is really great because you can lock in a rate now for the age that you are now. And what is also important, I'm gonna actually come back to this, is that this year, the disability insurance is guaranteed issue, which means that the disability insurance cannot be denied due to pre-existing conditions, and pre-existing conditions after the first year of coverage cannot be excluded. Disability insurance typically is allowed to exclude or straight up deny coverage for any sort of pre-existing condition, whether it's a chronic condition or a pregnancy that's already in term, I guess. They can be excluded if you have them before the disability coverage starts. In this situation, that can't happen. This will not be available after this open enrollment period. The company allowed it to happen 2 years in a row, and they won't let it happen again, basically. So it's really important that folks know about this, and that they have the option available to them if they're interested in it. Disability insurance, this particular plan will insure benefits up to 6 months. The sort of default option is for anything that happens outside of the workplace. So there is an on-the-job rider you can add if you want it. It costs a little bit more, but because of the guaranteed issue offering, this can be particularly useful for folks who have chronic health conditions that may not be impacting their ability to work now, but might in the future. But it's also really important to just keep in mind that we know that disability does not discriminate based on age or any sort of demographic. It can affect any of us at any time. Disability insurance rates are a little bit tricky to calculate because they are insuring income, the cost is totally responsive to what your income is. I have a handout that we'll send out that sort of walks you through how to calculate it. But these are the sort of base rates per $100 of benefit that would be provided to you. So with disability insurance, you can insure up to 60% of your income. So you decide how much of that 60% you want to insure, divide that amount by 100, and multiply it by the cost per 100 for your age bracket on January 1st. The broker will walk you through quoting this out. So it's not something you have to calculate for yourself if you're not sure of all the different variables. Are there any questions about the short-term disability before I move into a little overview of the accident insurance? All right. Accident insurance is, like I said, also voluntary, something that the worker pays for themselves. It's a lot more straightforward how the pricing works. It's just a monthly premium written out here based on, you can add dependents, which you can't do with disability insurance. You can have coverage for just yourself as a worker. You can add a partner, add children, and the premiums correspond accordingly. Accident insurance, like I said, offers these, they have like essentially a list of like different things that can happen if you're in an accident of some sort, and has like costs that they will pay out corresponding to the different things. So there's a different amount for if you're in an ambulance. There's a different amount for if you're admitted to the hospital, if you need follow-up treatments, if you need equipment or lodging related to recuperation. It goes quite in depth. We have the sheet written out and listed on our website. It's something that is sort of useful to think of as supplemental to medical insurance, for if you have a plan that perhaps has high copays or a high deductible, it can really help in filling some of those out-of-pocket costs. It is not a substitute for health insurance, and if you don't have health insurance, it doesn't come close to covering the potential costs that could come up because of emergent medical needs. And it also won't meet the requirements for what's considered a health insurance plan if you're looking at that sort of like minimum essential coverage sort of guideline. And yeah, unlike disability insurance, which typically only corresponds to outside of work incidents, accident insurance is for on the job or off the job incidents. So disability and accident benefits are available to anyone who's a member of the USFWC, whose organization has paid the $75 access fee for the benefits. It's a annual $75 per organization fee for access, and then folks from there can decide if they want disability or accident insurance or both. To qualify for the benefits, folks have to work an average of 20 hours a week. For disability insurance, people have to be on payroll or being paid as an owner. The billing happens directly through Diversified Human Solutions, the broker, and we do the billing for annual fees. And again, this is just a per organization fee. So it's, you know, if you have folks who are interested in this, even if you have one person who's interested in this, it's a pretty low organizational investment for people to have access to these benefits that can be pretty critical. And yeah, to get started, you basically just need to decide as a workplace if you're going to move forward with it. Notify me, and I will send the enrollment form and an invoice and answer any questions that are available that come up. It's the workplace's job to distribute the enrollment form, and then the follow-up to the enrollment form happens between the individual and Diversified Human Solutions. So it's a little bit more involved if the workplace wants to pay. The system's really set up for the voluntary benefit where the individual pays. At which point it's really like an individual to individual case. Yeah, are there any other questions about accident and disability insurance? That is not a pre-tax deduction. They're post-tax. Yeah. So some key links we have, I'm going to stick these in the chat once I just review them, but we've got a worker benefits interest survey / qualifier quiz, which is it's a useful tool for folks who are sort of introducing themselves to this for the first time and want to make sure that they really understand what benefits are available for their particular workplace configuration. The worker benefits website has all the information about our program and has links to all of the plan documents. We then have our knowledge base frequently asked questions website, which we might be switching over to a different form soon. The link it'll still be linked from our website. And then we have our public box files that have all of the plan information. Thanks, Kate, for linking those in. And so yeah, that's the presentation. We have still about 20 minutes or so for questions or just general discussion, feedback, thoughts. The next webinar that we're offering is on Tuesday, October 12th at 5 p.m., which will be presented in Spanish by the wonderful Kate Barut. I will be there, but I do not speak Spanish fluently, so I will not be presenting. And yeah, like I said, we have a presentation at the Worker Co-op conference, specifically about health insurance options, and our broker will be presenting that with some insight onto sort of the various tax implications of all of those different options. And then we'll have a bilingual webinar in November where I'll be doing sort of just a general overview and answering any last minute questions that are coming up for folks. In the meantime, this is what I do all day, every day. I'm here to answer questions either via email or over the phone. And yeah, super excited to be working with you all and appreciate you all. Did I miss any questions in the chat while I was doing that spiel?
I think you're good. I didn't see any. Oh, maybe.
Hey, I just added one.
Oh yeah, so health insurance will be covered at the Worker Co-op conference. Hey, Isla. And so that presentation is on November 5th.
Okay, awesome. Do you think that I could talk to you about health insurance beforehand?
Totally. Yeah. Just email me.
All right, awesome. Thank you. And thanks for today.
Yeah, thanks. So hospitals, Jen, are you speaking specifically about accident insurance for which hospitals acknowledge the insurance?
Oh, sorry, I misspoke, not hospitals, but for like the dental and vision, like, I guess like in regards to, since there's like multiple locations, like, and sometimes like they don't accept like specific insurance, right? Or you have to kind of inquire. I wonder if you guys had a list or like a database that we can use to input like a zip code, then it populate like locations.
Totally, yeah. So each of the insurance carriers, both Ameritas for dental and IMED for vision, have databases of in-network dentists and eye doctors for IMED. IMED doesn't have dentists. So yeah, we have instructions on how to find those databases in a lot of different places, and also as part of a handbook that we send out when after the open enrollment period is over to enrolled members. And with Emeritus, as I said, if people have like an existing relationship with a dentist who they really like and trust, even if those dentists aren't in network, they'll still be eligible for reimbursement for services according to the sort of like standard cost of those procedures that the insurance company identifies.
Okay, thank you. That's really helpful. Also, last question. Sorry, I have like so many questions, but
These are great questions.
thank you. But for Kate, Kate said that in regards to like registration, I filled out the interest form. Other than that, do I just have to be then on the lookout for October 1st when that opens and then be in communication with you?
Exactly. Yeah.
Okay.
On October 1st, I'll be sending out sort of more detailed information, like what I was talking about today with like, here's the form you need.
Mm-hmm. And I
Yeah.
understand also like that the call was recorded. Like I know you said that you'd send the slide deck, but I actually kind of do want to just like play the Zoom for our members because I think like you might have explained it better. Is that available or?
Yeah, the recording will get sent out with the follow-up email for this webinar.
Okay, thank you so much. Thank you for your
Yeah,
time.
thank you for the questions.
Hey, I have a quick random one.
Sure.
We just signed up as members for the Federation. Should we wait till
Awesome.
after our like orientation, which I think is in October, to like set up a meeting with you more directly? Is that, or does it not matter kind of chronologically?
If the chronology doesn't really matter. Or if your membership is done and you've paid your dues and that's happening already, like then it really doesn't matter. The order of how you receive the information is also sort of moot. It's just like you have to be a member to enroll.
Totally. That's great. Thank you.
I think they're not members quite yet, but could they fill out the interest form beforehand before we do our onboarding call, since my onboarding calls are kind of far out right now?
Yeah, totally. Yeah, and Kate and I are in regular communication about how sort of everything's moving along.
Yeah,
Phenomenal.
like if you want to get the ball rolling on that, Cliff, while we're waiting for our call.
Great. That's perfect. Thank you.
Cool. Well, I think I'm gonna stop the recording, but I can hang out on the line for